Thank you very much. And I'm going to get to introduce you to Kim McNicholas. And Kim is someone I've known. She's going to moderate this next panel really well. And Kim, take it away.
Thank you so much, Mark. You all, I don't know how you'd choose between any one of them. They are all incredible, and it gives me a lot of confidence in the future of mental health. Well, shifting just a little bit, making healthy lifestyle changes is not only critical to reduce our risk for disease, but it is also critical for our mental health. And yet millions of people continue to make unhealthy choices. Why is this? And does the sick care paradigm play a role in this? If so, how do we change it? With me are three incredible panelists, and each panelist, after I give a quick spiel about who you are, say hello and add a quick bit that you'd like to add on there if you'd like. We first have Dr. Pankaj, Medical Director of Lifestyle Medicine Global Alliance and also co-founder of the CWC Project. He's also the author of the Turbo Metabolism book, 8 Weeks to a New You. Welcome, Dr. Vish. Did I say your name correctly?
Yes, you did. Yes, you did. And it's an honor to be here with such smart people. I listened to in and out of the sessions, and it's just really amazing the diversity of speakers that you've had. My interest is primarily in food as medicine and how we can optimize lifestyle. And just listening to a lot of these people, I'm just thinking from the lifestyle angle that so many of these disorders are related to lifestyle in the first place. So I'd love to see more energy being spent on that.
Thank you, Dr. Vish. Dr. Dan Pardi, he's a PhD, also an entrepreneur and researcher whose life's work is centered on how to facilitate health behaviors in others. He is the developer of Loop Model to sustain health behaviors to help people live a healthy lifestyle in a modern world. And he is also CEO of Human OS. Dr. Pardi, welcome.
Hey. Yeah, thank you. I've benefited so much from all the discussion today. It's great to be here. And so I have always been interested in all the things that matter that affect our health. So I have a master's in exercise physiology. I have a PhD in cognitive neuroscience related to sleep, but I never wanted to be a specialist in any one of the areas. I wanted to be that global generalist. My work now, I've been able to interview over 100 different professors and their work related to health sciences. My podcast is the official podcast of the Sleep Research Society. And I've been a co-author on now 35 peer-reviewed health courses. So it's going to be a fun journey for the rest of my life. I'm very happy and grateful to be in this field.
Thank you, Dr. Pardi. And we have Dr. Kianush Misaji. Did I pronounce that right? Is it Misaji? Senior Training Experience Manager for Freeletics, and Freeletics helps people to put their dreams of a better lifestyle into practice. Dr. Misaji, welcome.
Hey, Kim, this is Bambi. No, Dr. Misaji couldn't make it. So unfortunately, but we still have a great panel.
Oh, fantastic. We do. Dr. Pardi and Dr. Vish, we have a lot to talk about, so we should just get this underway then. I was even concerned about packing all of what we want to talk about into 45 minutes. So let's get started here. We as patients.
Sorry about that, Kim. Let me just jump back in here again, but we do have Neil, who is the CEO of Abide. I actually brought Neil in about a week ago. So he jumped in, and I'm so sorry about that. But Neil, go ahead and introduce yourself. So I just wanted to do that to you, Kim, just like throw you a curveball here.
No worries.
It's going to be a great addition. So Neil, go ahead.
Sure, no problem. Neil Ahlsten. I run a meditation company that's focused lifestyle-wise on the faith market. I think it's really interesting to combine the scientific evidence that we've seen in how meditation is able to decrease stress and help people have healthier outcomes with a lot of the core motivations that people already have. So trying to build on existing behaviors. And we've been working on this for 5 years. I actually left Google to work on this project, and we now have millions of people using the product every month and have seen significant sort of stress and health related, as well as insomnia and sleep benefits from being able to tie into the sort of motivations and behaviors that underlie how people already identify in order to help them be more successful in this space.
Fantastic. Thank you for joining us. Well, let's start with, we as patients know that eating healthy, working out, reducing stress, they're all critical to our well-being. So why don't we do it? Why don't we start with Dr. Vij? Why don't we do it? Why don't we eat healthy? We know food is medicine, and we know we should eat healthier. Why don't we do it?
Well, I think a lot of it is that we've shifted away from the way that we have evolved. And, we haven't evolved to, look around in the animal kingdom, and other than animals that are kept in captivity by humans, the cats and dogs that we have as our pets, mostly they go hunt for their own food and they eat whatever they can find. And that's how we have evolved too. But in our socialization, food has become this celebratory, rewarding, pleasurable activity, and associated with it is all the other things that we do that are not even food, like drinking alcohol and smoking and eating, sugary foods and drinking soda and buying candy and buying foods that are tainted with chemicals to give them unique fluorescent colors that we find to be appealing, and we're putting these things in our mouths that are not even edible. And that's become the new social norm. So thinking about food as medicine and eating to nourish the body is actually goes against the social norm. So if you want to fit in with what everybody else is doing in your community, in society, in your family, and in a party that you go to, in your celebration, you would be the odd person if you're not ingesting all of those things that are not even edible. So it goes against the social norm would be a long-winded short answer.
There still is something to putting all that attractive, the fluorescent coloring and, artificial flavoring in it, because randomly my cousins are Amish. They eat off the farm mostly, but they're even being influenced by society when they go into a store, and they came out to California and they were picking up every bright color they could. And it was disconcerting because we're influencing even people that shouldn't be influenced.
Well, you look at what happened in Hawaii, you look in the Polynesian Islands, you look at Marshall Islands, you look at the Native American population that has 50, 60, sometimes 70% incidence of type 2 diabetes and obesity. It wasn't that way. It's because they're eating this diet that is not native to them. It's not carbs because they were eating tons of rice and root vegetables that they would get out of the ground. It's because they're eating Cheetos and drinking, giant bottles of Pepsi, thinking that this is cool and attractive, and it is. It's designed to be. Mm-hmm. But in essence, this is an epidemic. It's an epidemic of an addiction, not that much different from a drug addiction.
Interesting that you said it's designed not to be. Dr. Pardi, are we being incentivized not to eat healthy and follow a healthy lifestyle?
Well, I agree with everything that Pankaj has said here. And what the modern food system has been able to do is design foods that perfectly suit our bliss point. And what that means is that we know how to construct a food that we will, once eaten, we will that behavior is reinforced, and we will seek that food in the future. And that is just manipulating our physiology. So we know how to do that now. And so those foods have a very powerful hold over our behavior. It does not mean, though, that we cannot reject them. It's just very hard to do. So if you revert to the default behavior and you're eating what everybody else is eating, then you will succumb to what everybody else is succumbing to. So I think personally with health, we need to start very young. So I love what Sarah was talking about actually in the last panel. We need to start when we're school age to learn how to do all sorts of things that are healthy in today's world and be successful at them. Because food and exercise seem like topics, but they're actually categories, and there are hundreds of decisions under each one of those categories. So these are a lot more complicated than they seem.
And it's so difficult. You mentioned that we do need to start earlier, but it's so hard when you have all the commercials and influence when you walk into the supermarket to buy all of these great, cool products. And in terms of exercise, to sit in front of your computer because you're incentivized to sit there and code because you want to get smarter, faster, and you have so much homework to do. But then, and also the things that actually are a result of the poor choices when you're younger don't manifest for most of us until we're later, when we've already developed this habit. That you have my dad who's 79 years old with heart disease, and do you think he's going to make critical changes? I don't think so. A lot harder at that point, right?
Yeah, I think that's a really good point, that can we actually become highly skilled at very complex behaviors once we are already at a point where, like, the disease process is evident, we've crossed that clinical horizon? It's possible, but it's challenging. So starting earlier, I think, is a better idea. So that actually speaks to one issue of the healthcare system, is that we're not used to addressing issues until they arise, right? The currently healthy is an underserved population, and yet so much of our society is unhealthy or becomes unhealthy. So we need to work well in advance of poor health occurring, so that we have the skills to continue to prevent poor health from occurring later on.
That's right. And, when it comes to, it's not just about diet, it's not just about exercise, it's also about stress. And, even though we know we shouldn't get stressed, we know we should meditate, right? We just don't do it. We know that we're even healthier when we pray, we take a moment for ourselves. And Neil, we don't do that either. Why don't we do that?
There's two main reasons of failure and success that we've seen in this. It's not really for motivation. I think people know that this is something that they want to do objectively, that they want to live in a healthier way, like we're talking about with the food conversation. The reasons for success is, one is not having a practice, right? So I think the more that we can glom onto existing practices, that's something that we've tried to tie into very much, is to say, you already do this thing. If you can tie up this meditation practice, if you can tie it into your morning ritual of having coffee when you wake up, or commuting, whatever that activity happens to be, having an alarm. I mean, we've found really interesting success, even from just giving people a morning alarm that's beautiful, that takes them into a meditation experience, to say, maybe the first thing you need to do when you wake up is actually reflect and meditate rather than start looking at your phone. That's one thing behaviorally we found to be very successful. The other one is around providing, and I think it's where adherence comes in, but if you can build into people's existing kind of life philosophy of why they make the choices that they make, it builds a really strong adherence. And so that's one of the things why we've gone in this route that a lot of other meditation companies have, it is building on the lifestyle and identity that a lot of people have, is to say, like, if you build on that practice that you're already in, that philosophy that you already have towards life, it adds a different level of sort of personal willingness to adhere to it that we've been able to build on. And so I think, and the social element is probably a third one, which is being able to get other people to speak into that. And accountability wise, you talk about like the success of breaking a lot of drug addiction and alcohol addiction things, is accountability of other people to be able to speak into that. And that's something, as like a faith communities have often been very strong in speaking into that. And we've been building on and leveraging that as well to get much higher adherence rates, which also we like on our product, because that means people retain a lot better.
You bring up a really good point in terms of accountability. And, when you talk about just that meditation piece, that reducing of the anxiety piece, you believe that actually prayer and faith-based meditation, in a sense, is much more effective than general meditation.
Well, I would lean specifically to one element of that we have seen, which is around the parts of the brain that light up when you're doing prayer, because there's a relational element in that space, as opposed to being alone, is you're sort of inviting in, at least in the Christian faith, this belief that you're talking to God, whether or not scientifically people can dispute all they want whether that's true or not. But the neurology is, it actually is what we've seen from MRIs, is it lights up a different part of the brain, which is related to relationship, which is related to releasing oxytocin and building up that kind of like love feeling that people have in it, which is a very important part of relieving stress, especially in a long haul, right? It's not just a short-term thing, but it actually builds up your capacity and your coping mechanisms to be more successful in future stress events. And that's something that we've seen and kind of play out. It's been really interesting to hear from users who use our product specifically for sleep, because the way that you fall asleep also changes how your neurology works at night in terms of the sort of the way that your brain is washed and clean and the way your neural transactions is sort of build. And so when people wake up in the morning, they actually feel more trusting and confident than they did when they fell asleep, because they felt like God's presence was with them at night and they were protected. Now, whether or not we have any scientific evidence for that part is totally, there's, who knows? But what you see in the patient at the end in the morning is an actual feeling of personal connection and trust that allows them to be rooted, which in sleep, we know that there's like pillars of sleep is that sense of trust. And feeling loved is another one, that those actually help you sleep and overcome insomnia.
I love this because I run a global nonprofit on the side that helps with patients with a very serious chronic illness. And one of the patients, she was told by 12 doctors that she needed her foot amputated. And she would pray every single day that there was life in her toes and life in her toes and life in her toes. And then, she found us, and we've been helping her and working with her on critical lifestyle changes, eating better, wrapping her foot, doing some natural things she's doing it every single day because she really believes that God does help those who help themselves, and she prays about it. I mean, that's her accountability on a daily basis, and she's doing this because she has such strong faith. And I think that that's so important, right?
Well, exactly. And people have different reasons to have faith in things, right? We all know there's different motivators that will drive people, and there's a segment of the population for whom that's a really strong motivator. And if you can tap into that for that segment of the population, I think you can see much higher, like you were talking about, adherence to these things, because they're like, well, this is what I'm supposed to do, and I believe it's going to work, therefore I do it. And that just helps them makes them be much more successful in their experience.
I'm curious as to Dr. Vij, what your thoughts on it. Is that not so practical in your beliefs? Or do you believe that actually you find that actually does impact the adoption of, let's say, people who are told, hey, you need to eat food as medicine and you need to adhere to it?
Right. Well, in medicine, we call that the placebo effect, right? And that's a real thing. If someone believes that, this, whatever they're getting, they could be getting a sugar pill and you're telling them that they're getting pain medicine, their pain will actually decrease, and it can be demonstrated and proven. So there's no doubting of the mind-body connection for sure. And it's a continuum, right? So we're talking about how mind can influence body and body can influence mind. And, again, taking it back to food, which is where I think a lot of the action is, there's a clear connection. And earlier you were asking a question about your 79-year-old dad not knowing when he was a kid that his decisions of whatever he was doing would affect things when he was 79. And I would argue that no, even as a 4-year-old, right? When someone says, hey, my kid gets really hyper when they eat too much Halloween candy, right? I don't want to give them too much sugar because they're going to start bouncing off the walls. Or is it the sugar? Or is it, again, the yellow number 5 dye that's in those fake carrots and peas that they got in their candy? And so the manifestation, the symptoms might be different for a 4-year-old compared to a 79-year-old, but some manifestations are already there. We know that strongly. There's strong evidence for ADHD, right? We have an epidemic of attention deficit disorders in children. And there's many treatment centers that are based around changing all of these things that we're talking about, the lifestyle factors. You start feeding them a diet of whole plant foods, unprocessed foods, lots of, real peas and carrots, not candy peas and carrots. You eliminate the soda, the caffeine, the dyes, the high fructose corn syrup from their diet. You give them the omega-3s, and lo and behold, their symptoms disappear. So yes, I mean, there's something to be said for having faith. When someone goes to their doctor, I have people that come and tell me, even before they go to the pharmacy, right after at the end of a 15-minute conversation, hey, I already feel better just talking to you. What's that? Right? That's another form of somebody's faith, trust, confidence, belief in whatever power that they believe that this other human being has, or they're channeling something from nature.
That's really important. The attention from a medical professional, the love, the belief, the attention, the understanding makes so much of a difference in compliance of patients. I recently put together a poll. I have 7,000 patients I work with in our community, and we had 2,000 something respond to this poll. And that where I asked the question, what would make you more in compliance with your doctor's orders? And the number one answer, 75% of them said, if their doctor would only listen. If they only felt their doctors actually understood. It's that love, the understanding. It increases the accountability, I think, for patients, don't you think?
Oh, absolutely. There's some evidence to show that doctors interrupt patients within the first 15 seconds of the conversation. And they want to jump in and tell them what to do or what's wrong, and let me tell you what's wrong with you and how we solve this, instead of just listening and receiving. And there's so much power in that.
I definitely agree. Do you think that a lot of what we see, why we don't have that time, why we don't have that part of that understanding, is that, we're really in a society where we have a healthcare system that's trying to find illnesses. We have that sick care system that we've been talking about this conference, and it's really ingrained in all of us as patients. Dr. Pardi, what do you think?
I think this is one of the biggest issues for why we see poor health in society today. We've had a very successful healthcare system, and it does certain things very well, although of course it could be improved in many ways, even in what it does. But we really need a separate branch of the healthcare system for it to be more complete. Mm-hmm. And that separate branch would be self-care training. And undoubtedly, there are many medical professionals who take on a personal interest in how to promote health, but it is oftentimes separate from their training, that effort that they put in. And so training for other people to be healthy looks different than what medicine is more about treatment. So you are evaluated to see if there's early signs of some sort of condition or signs at all. And then there's either a referral or a diagnostic or a procedure. That is okay for sick care, but that's totally different than how we would get an individual good at embodying known knowledge about how to live differently in today's world. We just need an entirely different system to facilitate that. And so part of this is also a handshake, because society is not taught about what they need. So we typically think we are healthy until we get sick. We go to our doctor, and then they make us better. And what I like, of course, now is that there is this conversations around behavioral health, and there are new quantified self-technologies that are about taking sort of good behavior change techniques and paradigms and putting them on your wrist or in your bed or some way to try to help motivate different types of patterns of living in your day. And so we're on a good road, but we need to get there faster because the cost burden of how we're living is really problematic.
It's hard to change something overnight. I mean, you can't just put on the brakes. I mean, this has been a long time coming. Our entire healthcare system is based on here's a pill, and we train our would-be doctors on how the symptoms that would, mean that you need this pill. I mean, that's literally, and I don't know if this is shocking to people, but that's exactly how our healthcare system began. That's how our universities, our medical schools actually began. They began around a pill, right, Dr.
And, it's been very successful in some ways. And so I think that there is some ideas out there that the medical system is just in the pockets of big pharma. It is, when you go to your doctor, you are not getting evaluated for all possible types of interventions. Mm-hmm. It is really, should this person be on a medication or not, or have a procedure or not? Of course, there are exceptions. And as one of the panelists said earlier, I believe it was the doctor from Amwell, we do need a full spectrum of solutions. So I'm not anti-sick care at all, but I think some of the over-medication issues that we face or that we see is because the medical system is confronted with a huge just wave of lifestyle-related diseases, and they want to help. And the way that they help, they have very limited toolkit. And so that's why we do need a pretty significant structural change, and quick.
And Neil, what does self-care training, do you think, really look like? It could even start with your app.
Well, absolutely. And I love what was just being referenced here by Dan about the methodologies that you can apply, define what questions you ask, right? And so, you know, for us, I think one of the things we've started to press into a lot more is coaching and lifestyle coaching, because there's a lot of different problems that people have that are really not even about the app experience, right? So coaching people on the idea of good sleep habits and falling asleep, and like, what should you do? What kind of screen time should you, when should you turn your screen time off? That idea of being able to pair in a lot of personalized coaching is something that I think helps people be much more successful across a broad spectrum of things behaviorally, right? To that then you can offer a much broader range of services that then allow you to ask better questions of the audience, of your patients, of like, what do they need out of this experience? I think that's one area where I've actually seen increasing success, because sometimes just small nudges can make a really big difference. Just getting that reminder on your phone that says it's 10 o'clock, it's about time to start winding down for bed, right? And like turn off your lights or turn off your TV and disconnect from social media. Those kind of things and the coaching that can go around, I think, have a really big opportunity, particularly when a big part of the problem is the phone. I laugh at our response, you know, to helping people sleep better by using their phone, when their phone is probably one of the biggest problems they have to fall asleep. Trust me, the irony is not lost on me, but it's like trying to help meet people in that space is an area where we've seen particular success. And I think really Dan's point around, make sure that you're asking the right question and you have the right toolkit of procedures. Otherwise, you're going to just try to shoehorn people into the wrong procedures, and you're going to wind up giving them the wrong pill and selling the wrong thing. I think that's something that we all have to be mindful of in our therapies.
Yeah, but in terms of some of the most vulnerable communities who are not driven, they're not app motivated. I mean, you have a million apps that are out there. You have even, this is my favorite, you have cardiac rehab programs, and they've even gone remote, and the compliance for those remote rehab programs are like this. Their adherence to those rehab programs, once those 9 weeks are over, that's in the negative territory, if that's even possible. And these are the most at-risk people. How do we reach them? They have coaches, right, in those programs. What do we need to do to help them to almost want to change? Because they're the ones that are weighing on our healthcare system in a very, very big way. And apps aren't doing it.
Go ahead.
No, for that community in particular. And so I have a feeling that you have a plan there that I can tell.
Well, you know, a lot of it, I think, is about figuring out what channels those people are present in and where are they doing things that are going to impact them, right? Because I think one of the things that I had a broad experience in health back in Africa before getting into this space. SMS messages. I mean, we go back into this. It's like if they have a phone, you don't need an app, right? You can just send text messages. And I know there's HIPAA rules around what you can and can't send and how that works. But it's about using the channels that people find effective. I mean, we're using TikTok, right? And we got all sorts of people on TikTok who are doing behavioral health stuff because it's awesome. Because we've got we literally hired influencers over there to start making health messages because they know how to dance and do funny and but those messages are getting into people's minds. It's about how do you be relevant in those channels where people are going to actually, those communities who are not as easily accessible. And that's a listening process to learn. Yeah.
SMS is huge. Dr. Felicia Facarete, who's over in Mississippi, an interventional cardiologist, and he's been the most vocal to prevent amputations over in the Mississippi region, and especially in the South. And one of the things he told me that still hits home is he said that most of his patients he can't even get a hold of. They don't even have internet. They don't have cable. He said the only way, if anything, is to actually reach them via SMS. And so I think that you hit the nail on the head with that. Too many apps out there are just going straight to notifications. They don't even get those. So one, SMS is huge. Number two, as you mentioned it earlier, faith. Many of them go to church. How do we, and Dr. Vies, you should even, weigh in on this, because I think it would be really interesting to hear your perspective, is how do we get the faith-based community involved in improving the lifestyle of a lot of these patients, and with that, even the mental health with these patients?
I like the idea of meeting people where they are, and if they don't have an app or they're not going to get the information in a 15-minute doctor office visit, but they love to go to church, and they're spending 2 hours every Sunday with their community there and listening to what the priest says. Let's have the priest tell them. That's how it used to happen in the old days. And frankly, we're doing it now. A lot of COVID vaccination and messaging is happening in these communities. One of the most successful programs in lifestyle was the DPP, the Diabetes Prevention Program, where they took people who would, in today's nomenclature, be called pre-diabetic, people who would be at risk of becoming diabetic, and they put them into a lifestyle medicine program and compared it with a drug called metformin, which is considered one of the best medicines for type 2 diabetes. And this program was administered where? It was administered at a very low cost at YMCAs across the country. And the results were astoundingly, the YMCA administered lifestyle medicine program was actually twice as effective at preventing pre-diabetics from becoming diabetic than metformin. But guess what made it to the front page of the New York Times? That metformin is this wonder drug. It's a 32% reduction in progression of pre-diabetes to type 2 diabetes. The fact that lifestyle was twice as effective, more than 50%, was not even in the news. And part of my fight back here on behalf of the medical community is that it's not entirely the fault of the medical community. That's the expectation from the consumer too. They come to the doctor and you tell them, hey, you have to stop going to eat Big Macs every day, and you have to walk for 10,000 steps a day, and you have to shut off your TV and go to bed by 10 o'clock, and you have to stop drinking your 6-pack of beer. And they'll say, well, what's the point of that? And I'll say, well, you live 10 years longer. And they'll say, why? I don't want to live 10 years longer if I can't do all those things. Can't you put it in a pill? I'd much rather take a pill, and rather than do all these things that takes time and effort and really takes away from what I define as pleasure in my life. That's the only pleasure I have. So, it's a complex thing. And then referring back to the previous session, I mean, the whole thing about the VCs weighing in was, okay, so how do I make money out of this, right? If I'm a VC, I can make money out of a pharmaceutical intervention or a device that does something, but am I really going to make money out of getting people to eat more broccoli? That's what the VCs might be asking. If Mark is still on the call, I'd love to hear his thoughts on that.
Oh yeah, that would actually, that's a really good question.
I heard broccoli, of course I'm on the call. It's a magic word. I agree. I've been spending, we've been spending a lot of time with the folks at UC Davis talking about this entire subject and building up their own version of a health hub. So the answer is yes. And look, we got to eat. We've got to eat better. I mean, the story. But I think from a VC perspective, yes, we're writing checks. We're writing lots of checks for programs and systems in these areas.
How do we incentivize more? How do we make money off of health versus sick care, healthcare versus sick care? How do we make money off of this?
That's preventative care, but that's what it's there are dozens of unicorns in preventative care right now. That's exactly that is the opposite of sick care, and that is what we're all betting on, because it's so much cheaper to obviously take care of someone who is not sick than what happens when they are sick. That was the first thing I learned when I started walking the halls of UCSF. How do we keep people out of here?
Mhm.
Well,
And
can I answer your question just a tiny bit?
yes.
You know, what is changing and shifting is the models like One Medical and direct primary care models like IORAS and CityBox and Crossover Health and Premise Health. All of these primary care networks are going at risk with the employers. And when they will be going at risk, they will be looking for solutions like these, because right now, to monetize the eating healthy and all the 4 pillars of health is just a concept, an idea, and nobody has been able to monetize it. Essentially, all the people who will be going at risk, whether it's a virtual primary care or a real brick and mortar, it's going to become more monetized.
I see Dr. Vij. Thank you. And I see Dr. Vij, you're nodding. What is your reaction?
Yeah, I totally agree. I mean, I know that's the answer. And if we can shift the incentive upstream to the people that are paying, and if they can see that if, you know, your dad didn't need that stent when he was working for, say, HP with Archana, he was an employee, and Archana knew that if he was, you know, doing XYZ behaviors and showing these changes in his cholesterol numbers, his blood pressure, his blood glucose, you know, not smoking and all those things, and she could then incentivize him in some way and have him pay lower in his insurance premium, then everybody wins. And he wouldn't be in a situation when he's 79 years old and he says, I've been doing this all my life and nobody told me when I was 45. So what, you know, why should I change now? And besides, the damage is already done.
You know, you bring up a good point there, just in that if someone doesn't think they have any hope that their lifestyle changes at that point in their life are not going to make a difference, they're not going to do it. They're not going to stop smoking. I had a patient just today and just so excited that he was told amputation was the only option. He already lost 1 leg, yet he still did not stop smoking because the doctor told him, well, your legs are they mirror one another. So you're going to lose your other leg no matter what. The wheels have already started turning. No matter what you do, you're still going to be legless. And I introduced him to a doctor in our network for my nonprofit. And today he saved his life. And today when he walked out of there, he quit smoking for good because he finally had hope that he could be walking if he just stopped today. And the smoke would stop damaging his arteries, stop triggering that inflammatory response, and he could actually live a better quality of life. So I think instilling that hope is really key. Do you agree, Dr. Vij?
Oh, absolutely. Yes. But I don't want to take up all the airtime here, but I have an example of a patient who was recently diagnosed with kidney cancer. And it was a completely incidental finding. He had gone in for a kidney stone, which also he had never had, but he has this pain, blood in the urine, goes to the ER, gets a CT scan, and they said, bad news, you have a kidney stone. Good news, you already probably passed it. Bad news, we also see this other thing on your kidney, and it turned out to be a tumor. And he had been, he's just very strict with his diet. He's been eating a whole food plant-based diet for the last decade or so and doesn't smoke, walks 10,000 steps. He's an evangelist for lifestyle. And call it faith or whatever you want to call it. But, you know, he says, my urologist says that I probably had this for 5 years and I think it hasn't grown or spread because of my lifestyle and my diet. But I'm going to continue to do that. They'll take the tumor out. And, you know, my chances for 5-year survival is still 97%. I'm 72. I'm probably going to live to 80 like I would have. And so absolutely, faith and hope and all those things can work together. And I think we can all come from our different directions. It's like, you know, the 9 blind men and the elephant. And it looks different, but it's actually one big elephant that we are all seeing from different angles.
And so who is going to provide this hope? It's really tough for a general practitioner to provide that, or even a specialist cardiologist, pulmonologist, a urologist to provide that in 15 minutes. But Dr. Pardi, you have an answer for that. You believe that we should start training health performance experts.
Yeah, so I brought this up a bit earlier, and admittedly, the idea is new, but I think that we need, obviously lifestyle is a huge burden to modern society. It accounts for 80 to 90% of the cost burden. And that includes loss of productivity, which is a comment that I'll come back to in a moment. But we don't have that credible expert in health, somebody that has you can't get formal training to become a generalist in all things that relate to health promotion, which would include all the different determinants that affect your health, but also understanding how to work with individuals, working with groups, working at the level of the board of a company so that decisions about productivity are counteracted with some input about what the impact that's going to have on the health of the employees, and also how health can improve productivity as well. So we need that, I think. And otherwise, if we always have health be subjugated to the sick care system, it won't live up to its full potential. So that's why I think we need that. Now, these days, you can become an exercise physiologist or nutritionist. You can become an expert at one of the different categories that matter, but I think you should be able to become an expert generalist. That's one idea that I have. So I'll go back to one idea from previous. We're using a lot of terminology of the sick care system. So for example, prevention, which we know to be a rather feckless term at getting people to change their behavior. It's hard to prevent something that you don't have. But prevention is not the only reason to live your life a little bit differently. In fact, the best pre-diabetes program needn't mention the word diabetes once, because at the end of the day, this program simply has to get you to do the things that are preventative ultimately. But it could be about other aspirations. It could be about performing better at your job and the real demands of your life. It could be about having a healthier family. There's many different reasons we can ascribe to, but I think a really good way to start is to say, what are the actual demands of my life? What does health really mean? It's functioning and resilience. And how can I use my health practice to actually be a better version of myself? Because health is not binary, it's a continuum. And there is an opportunity for each of us at every stage to actually drift down the continuum or up the continuum. And so this stuff, again, is quite hard, but it's achievable. Humans are capable of doing very complex things. We just need the right system to then train individuals to be really good at hard stuff.
Yeah, we need places like UCSF, right, Mark, to adopt a program like this and to bring in a training program for healthcare performance experts. Do you think that that's something that's feasible, or do we need to get our Medicare system online and get that reimbursement taken care of?
Well, a lot of this is going on, department by department. So it's, I think that, you look under the covers at UCSF and UCSF Health, you've got a number of different hospitals and systems with so many things in trial or so many basically experiments going on. We all want this to work, right? So, there's nobody who wouldn't agree more that there are better alternatives than pills.
I think what UCSF is looking into is something that even Stanford was doing. Is called Educator for Care. So it's almost like every touch point with the patient needs to be on a positive note. The prevention word already has damage to the body built into it. So you almost like fear-based, protecting yourself from something that's dangerous. Vitality, on the other hand, is a much better goal for people, or the best version of yourself. And so it's almost like you need a content writer for every touch point that you do for patients. So you have the provider who is talking to the patient, has a positive psychology training, so then they are able to deliver information in a much more positive way. And then, the question about hope becomes less relevant, because now the person who is having potentially both the legs to be cut off is discussed in a much more logical way, that, you don't just have one artery in one leg left. You have so many arteries left. Like if you quit smoking, there is 10,000 arteries you're going to save. Now suddenly the perspective changes. It's not just a leg that they're saving the whole body. And then life becomes a much different perspective. So I do feel some of the health activists, so to say, or evangelists, they live everywhere. Anytime they touch patient, you need to change the conversation.
And I think that whole turning those appointments into positive experiences for patients and moments of positivity are really key. A patient that we've been working with, she was 317 pounds, but through our efforts, literally she's dropped now to 275, which is really exciting for her. And she said to me, I said, how in the world are you doing this? This is incredible, because I like to give the patient the credit. It's all you. You're doing this all yourself. And she said, no. She said, do you know how Jesus would heal people? He saw people in their wellness. That's how he healed people. You saw me in my wellness. That's why I'm healing. I only wish that my doctors would see me in my wellness, and I probably would have healed sooner. God, I still get chills hearing that. It's incredible. That's a really important point. And I think as Dr. Pardi said, that, a health performance expert might be that person that is part of that healthcare team who could make it happen. And I see Neil nodding. You agree? Oh,
absolutely. I mean, I think that the whole idea here that the healthcare professionals can bring in hope, that they can bring in by participating, in as listeners, and is very evident and is very true, and is something that if it takes more training, if it takes more, sort of whatever it takes to get there, is probably a really helpful thing. Because I mean, that point that you were talking about in your poll, trust me, like I was taking notes on that, about just doctors listening to their patients, and because listening itself is a form of emotional connection. That those tools, be as they may, not necessarily as direct in the pathway to the actual, figuring out what the root cause, the issue is, they lead to significant changes in adherence and in significant changes in a willingness to do it, which is, as in many cases, as big of a problem as actually figuring out what's wrong. I think in a lot of these. So I'm just in full agreement that doctors have an incredible role to speak into that.
And you mentioned, when it comes to listening, how do you find out if you're really listening? You do a poll with your patients that asks this question: what don't I know? And I did that about interventional radiologists and over on interventional cardiologists and vascular surgeons. And what I discovered is that, doctor, you aren't listening. I'm in pain. You need to do something. And it's like, whoa, wait a minute. That's huge. So if you listen, you can actually do something about it. So I think that's incredible. And Dr. Vij, in terms of having a health performance expert, someone who may listen better, how do you see that playing out?
Yeah, I think it's, in lifestyle medicine, we talk about a multidisciplinary approach. And there is some hope. Places like UCS have pioneered a new curriculum where right from the outset, the idea is to select people to go into medicine that meet a different, they're not all about physics, chemistry, math. Let's analyze this problem and break the body up into its parts like a car, but instead let's think about the biopsychosocial determinants and look at what's affecting this person. Let's look at their home environment, which, by the way, COVID and telemedicine has enabled us to look into people's homes, and sometimes you see in the background what the lunch that they just ate, or the wrapper from a fast food place, or empty bottles of a beverage, but looking at the whole person. And really, if you think about it from the perspective of human performance, I agree with what Archana was saying, that it becomes a positive thing. It's like, hey, we're here to help you be the best version of yourself, and to look better, to feel better, to make more money, to have positive experiences, to connect better, to love better, to be loved. And that's a lot better than, tell me what's hurting and I'll give you a pill for it. So I love that idea. I'd love, if there's a venture like that, Mark, sign me up. I'll go work there.
We are tight on time and we have to wrap things up, but we could keep this conversation going. I think we're going to solve this. It's going to turn very quickly. I want to start with Neil. Any final thoughts?
just again, pressing into, and this is where I invite anybody who would want to speak about this further, connect with me over LinkedIn or through the panel, is about tying into people's core motivators to help them be successful in health outcomes. I think there's just a lot of opportunity here to do that by thinking about those core motivators and drives that people have and their identity and their faith and where they spend their time and how we can build on those practices to lead to healthier outcomes. I think that's just an area of opportunity for us as we're looking to sort of help nudge people in directions that sometimes are hard with those unreached populations.
I agree. Dr. Pardi, final thoughts?
Yeah, I will say that we've talked a lot about people who are quite sick, and undoubtedly health is a component for healing. That should come under the sick care system, under the direction of the sick care system. I'm talking about, well, you never want to break your leg, right? But if you do, you want a very effective sick care system there to treat you. I'm talking about how do you then not even break your leg in the first place. So aside from the sick care system, we need to think about what the self-care training would look like. And that is going to meet young people when they're developing habits. It's going to be of service to families so that they have support systems at home. It's going to be at workplaces where people are spending most of their time. That alone is a huge conversation, particularly on mental health. So thank you. Glad we had a chance to talk about this. The whole day was great.
Dr. Vish, final thoughts?
Well, I think we're really at the cusp in human evolution in the way that we think about our lives and how we're all interconnected. And this pandemic has been a catalyst for much needed change. And so a lot of people say that all the stuff that came about with telemedicine was 15 years in the making and it was an overnight phenomenon. But I think we have a tremendous opportunity here to change the way in which we deliver health. We still need to take care of the sick, but we can change the way we can help people to really be the best versions of themselves. And if that can be monetized and made profitable and we can motivate people to change and convince them that that's how they can have more of whatever it is that they want in life, then it can really be a win-win-win.
Thank you so much, Dr. Vish. And since Mark and Arshana chimed in and provided incredible insight, any final thoughts from either or both of you before we move on?
No, you've got rock stars on this panel. I couldn't possibly add anything that these guys are saying.
Thank you, Arshana.
That's like positive psychology effusing out of Mark at this point. Rock stars for everyone.
Yeah.
I think this was a fantastic day. This panel was amazing. I'm sorry I was not able to be on camera for a bit because I had other work to take care of. But I think we need to recognize that it has to be a patient-centric approach. And so long as you can put yourself in the shoes of the patient and imagine what it would feel like for that patient to be in, I think then you will be able to design a solution. So the empathy is the beginning of innovation for everything across the world. And I think once we start from that point and then quantify each of these touch points and figure out how you can make it a positive touch point, I think that would be extremely valuable for all our patients.
Very well said. Thank you to all of our panelists. Bambi, thank you so much. Back to you.
Yeah, Kim, a great panel. You did a marvelous job. That was fantastic. I thought you brought out some really great points. And so thank you for joining us. And I want to say something to Pankaj, because you said this is an evolution. I think we're going back to 1950s, which is sort of the humanistic psychology, right? Which is Abraham Maslow sort of going towards self-actualization. And I think that's a positive step. And that's not an easy sort of cultural mindset to embrace. So it's taken a while and it's going to continue to take a while. Arshana and Mark and I this is our 4th year. And I'll tell you, today is far different from when we first held our future of mental and behavioral health. Our understanding has just grown and so much, and sure, the pandemic helped quite a bit, but this shift in mindset it takes a while. to understand how we need to shift that mindset. But until we shift that mindset, then we can't even create the technologies that we need. So I think it's an important to be able to take, to shift that mindset. And I think that companies like Verta Health, these verticals that have really focused on these chronic conditions, as you guys were mentioning, we need to get the payers to pay for this stuff first. I think that they've been great pioneers in showing the way that we can actually reverse diabetes through these, through our behavior. And so, but it's early on, right? They just were founded in 2014. So not even a decade. But a lot happening in this space, and we are super excited. We're going to host it again, I'm sure, next year, but maybe next year will be live at UCSF. As Mark noted about those, the presenters that came, that presented in the last panel, they were just fabulous as well, and talking about the different verticals that they're going after. So hopefully the attendees saw some of that. We will wrap it up, and we will have all of these sessions on video online. And what else can we say? We've already kept everyone longer than we were supposed to, so it's already 4:45. So I'm going to say goodbye and thank you so much for everyone for joining and tuning in. Mark Archanat, do you have any final words?
I just want to thank everyone to join in and be the best version of yourself on the panels for sure. And I am looking forward to the recording and sharing with all of my colleagues to see how we take behavioral health, mental health so seriously.
And I would just add, look how exciting this is, how this has evolved.
Yes.
Again, the last 4 years, the quality of the companies, the quality of the discussions, the billions of dollars that have entered into the space, in part because of COVID. But this is not a little, mental behavioral health is no longer a little niche that nobody, everyone wanted to be explained. It's front and center, and it's really exciting to be a part of that.
So you guys missed it, Kim, Dan, and Pankaj, you missed it, but we opened the event with a little gratitude moment. So we are taking this stuff seriously. We are being grateful and changing our lifestyle, even on a Zoom call. So I'll end it with a gratitude moment now. Thank you, everyone, for joining us. You will see more of these. You will see these videos online, Vator.tv, and we will see you next time, hopefully live at UCSF.
Great.
Have a good night.
Bye, everyone.
Take care. Bye.
Thanks.